Well, thank you very much, Sven, and I'm glad to join the panel. Eric has done a great job in summarizing, especially telemedicine and how that's really taken off in the midst of the pandemic. I just want to very briefly tell you about a study that we launched in March for the pandemic. It's called Detect. Basically, you keep hearing about testing, but we can't do testing in 330 million Americans on a frequent basis. And so even if we could, they're one-off tests and they have false negative results. So there's another way to get around this, and that is using digital surveillance. As it turns out, there's over 100 million Americans that have either a wristband, fitness band that emits heart rate data, or they have a smart watch. And so out of that 100 million Americans, of course, that cuts across all age groups. And we have shown there's a very crisp signal when you have an elevated resting heart rate, as well as less physical activity. And if a person wears their wristband sensor at night, more sleep. Basically, the sleep and physical activity are surrogates objectively for fatigue. So when you have resting heart rate going up and fatigue, we've shown and published about how that is a predictor for a flu-like illness. And now we are about to publish, we have preprint already, the crisp signal for COVID-19. So we think it's going to be emerging as a way to monitor throughout the US for people who are demonstrating the early signs, not on an individual basis, but for a cluster of people in any geographic location. Interestingly, in Germany, they have over 600,000 people that they're constantly monitoring these metrics, and they are using it as their national fever curve. They actually started because of our publication on flu, and it's working extremely well. So I hope that we'll get people to join the Detect study. It works on all devices, whether it's a Fitbit, Garmin, Apple, whatever, it works. So maybe some of the people who are interested in continuous monitoring, not a one-off test that's hard to get and takes a long time to get the results back, but this digital surveillance tool can be potentially helpful in getting a much better grip on the COVID-19 situation in the US pandemic. Thank you, Sven.